What if I told you that there are nurse managers all over the country spending dozens of hours every month just creating schedules for their staff? And what if I told you that there are nurses out there that are still dissatisfied with their schedules despite all the hard work and effort that goes into making them? My name is Alana Springer-Borkenstein, and I am thrilled to be here and share with you the Smart Scheduler, a digital tool driving fairness and efficiency in nurse scheduling at NYU Langone Health and beyond. So let me introduce you to the two main characters in the scheduling story. The first is Jessica, a nurse manager. She is literally spending dozens of hours every month on scheduling alone. She's drowning in spreadsheets, emails, paper, and sticky notes, and manually tracking to ensure that there are enough nurses staffed on every shift and that every nurse is working their required number of shifts. This is absolute chaos and ridiculously inefficient. And then you have Paul. He's a staff nurse, and he's constantly dissatisfied with the schedule despite all the hard work that goes into it. The process lacks transparency, so he's not sure why all of his requests aren't being honored. Sometimes he's looking left and right and feeling that his schedule is unfair. And since he's a new grad nurse, he doesn't have a close relationship with his manager and isn't necessarily comfortable knocking on the office door and raising his concerns. And Jessica and Paul are not outliers. This is a ubiquitous problem that we found in our research that affects 1.7+ million inpatient hospital nurses across the country. And this is a problem that needs to be solved now because nurse attrition and turnover among hospital-based nurses is at an all-time high. And we know that direct support from nurse managers really helps impact retention. So we need to free up those managers' time to provide more high-impact hands-on support for nurses. And so we built the Smart Scheduler. It is a tool that auto-generates a schedule that saves nurse managers a ton of time and that nurses are happy with. And it does that by optimizing for nurse preferences, the needs of the floor, and the manager's priorities. And so here's a little bit about how it works. First, the nurses enter their dream schedule for the coming month and their availability and preferences. And then the tool, using a proprietary algorithm that we have built, balances the schedule based on the manager's priority. This is the most painstaking part for nurse managers today. Today, they have to physically drag and drop nurses' shifts to ensure compliance in every shift for the coming month. Now we can do this in one click of a button. The manager reviews the schedule, publishes it, and syncs it with the HR management system. Nurses can then review their schedule for the coming month alongside an analytical dashboard that shows data and analytics on the fairness of the schedule that month and demonstrates patterns over the previous months. And then finally, the nurses have an opportunity to answer a very brief survey to share insight with their nurse manager into how the schedule is working for them and what kind of support they need in the coming months. And so here's what's differentiated about our solution. Like I said, the algorithm automates the very time-intensive balancing process for a nurse manager, but we preserve the human touch that is needed to keep these schedules great for nurses by enabling managers to customize the priorities and customize the rules to meet the specific needs and the unique cultural attributes of their floors. And finally, the third major differentiator that I want to emphasize here is that nurse feedback is critical to the success of this product, and we want to give nurses a louder voice in the scheduling process so that the nursing lifestyle can fit their home lifestyles. There are a number of phenomenal outcomes that come from this tool, but there are 4 specifically that we're focusing on and we know are tangible for NYU. And that is to reduce the time to pause the schedule by 1 week down from 3 to 4 weeks, allowing more time for nurses to make personal plans, improve nurse satisfaction, reduce call-outs, and reduce the time that managers are spending balancing the schedule. And we know that there's real value to be captured here. This is not just a nice to have. We have run the numbers, and by reducing administrative time spent, improving nurse satisfaction and retention, and reducing callouts, we can create $144 of value per nurse per month at NYU. And when you extrapolate that to all of the nurses in the US, that's a $3 billion market opportunity. And we have looked at the other players. We certainly don't want to build something that already exists, but there is no other player that automates the onerous schedule balancing portion of the scheduling process. There is no other player that emphasizes fairness and transparency in scheduling for nursing. And there's no other player that marries real-time experience data from nurses with scheduling capabilities to inform smarter, better schedules month over month. And so we've already started this work. After conducting interviews with nurses to learn what we really need, we developed a low fidelity MVP product that we are currently testing with 3 pilot floors. On the left-hand side of the screen, you can see what that looks like. It is not sexy at all. And even still, the nurse managers we're working with love it, are telling their friends about it, and are asking us for more. We've used that experience to document product specifications for NYU's workflow specifically, and now we are here asking you for funding to develop our solution into a tech-enabled, scalable, usable product for 500 plus nurses at NYU. We're asking for $194,000 to do so. The vast majority of this funding is allocated toward front and back end development, and the rest is used for ongoing data security and general development costs, as well as implementation costs. We know that this is a product that is sustainable and will become a fixture within NYU. First of all, it pays for itself. The cost savings generated within the first year cover the maintenance costs for the subsequent years. We have executive level buy-in. Our executive sponsors, Kathleen DeMarco and Will Winfried, are phenomenal and have got the Chief Nursing Officer, Chief Information Officer, and Chief Operating Officer in the loop and on board. And we've already identified nurse champions, nurse managers across pilot floors at NYU that are super excited about piloting this with us and have already strummed up enthusiasm among their nurses. So here's a little more about our team. Like I said, Kathleen Ann DeMarco and Will Winfried are senior directors in the nursing organization at NYU, and Eric Gruskin and I are recent graduates from Harvard Business School. We have been researching this product for the last several months, and we're super excited about the prospect of bringing it to life at NYU. So I'm going to leave you with this. What could a nurse manager do with 20 extra hours every month? What would that mean for nurses? What would that mean for patients? And what would that mean for the health of our communities? Thank you so much.